quick overview of the Heart of Texas. What's it like? Where's it located?
Heart of Texas Community Health Center is located in Waco, Texas, about 100 miles south of Dallas, 100 miles north of Austin. It's an incredible community. The total county, McLennan County, is 220,000 people. Waco, the city limits of Waco itself, has got about 115,000, 120,000, and then the metropolitan area of Waco is 165,000 people. Mostly, there's a huge portion of low-income residents living in Waco, Texas. The jurisdiction of Waco has about twice the national average for poverty rate.
So what is in your estimation, what is the importance of these public housing primary care programs in the community?
The public housing primary care grantees, and I think there's only 55 of them in the nation, and we're one of those 55, provide an incredible service to the poorest of the poor, the most vulnerable of the vulnerable in the community. The health care and the life issues of those living in public housing are far beyond what those of us that have never experienced public housing, or even homelessness for that matter, have ever had to suffer through. And so these grantees, these 55 of us that are focused on trying to address the social and the health care issues of residents of public housing, it meets just an incredible need.
Can you tell me one or two success or impact stories that you had on a couple of individuals who have used your program?
Well, I'm not sure I could give you one or two, but I can give you several hundred. We started our public housing primary care grant project in 2007. We were one of the later grantees. We started out sort of a bare bones operation. We had put a sort of a satellite site over into the largest of Waco's 3 public housing complexes. But we could tell right away it was going to be a smashing success, that we were really reaching out, in particular touching pregnant women and children that had frankly shied away from accessing health care. In very short order, we could see that they were just really swamping us, and so we set about the process of trying to build a new clinic, and just 2 weeks ago we opened up a brand new clinic, a 9,000 square foot clinic within sight of the largest of the 3 public housing complexes where we had the satellite site at. And so it's a 9,000 square foot site. That site will probably end up seeing 4,000 or 5,000 patients, unduplicated patients, and probably 20,000 visits within a couple of years.
Can you tell me what partnerships or collaborations would help you achieve your goals or would advance your initiatives?
Well, one of the greatest partnerships that we have, and we want to certainly keep developing that, is with the Waco Housing Authority, with Gary Moore and Millet Hopping that run the Waco Housing Authority, and they've been our partners from the get-go. In fact, they're 2 of the individuals that came to us and said, hey, is there something that we can focus on to really identify and help the residents of public housing? So hats off to Waco Housing Authority. I know that our relationship with our housing authority is extraordinarily good, and I know that not all of the health care for public housing residents grantees have the kind of relationship that we do. So first and foremost, that relationship with Waco Housing Authority. But we also have a tremendous relationship with our city of Waco, the jurisdiction itself, and with McLennan County, both local hospitals, and frankly the private medical community have all been very, very supportive in helping us do what we do best, and that's primary health care services for the vulnerable. And in this particular case, it's the residents of public housing, but beyond that, all of the vulnerable in our community.
Are there any that you would like to see, or partnerships that you haven't been able to forge that would help?
Yeah, and I would say we haven't been able to forge them, but I wouldn't put the blame on them. I'd probably put the blame on me for not really having the time and the expertise to be able to do what I need to do. Clearly, I need to be working with Housing and Urban Development more to see what type of options that might exist to better improve that relationship and expand the resources that may be out there and I just haven't been able to take advantage of yet. So that one comes to mind. Probably some state resources, and I think that from a federal level, I think the feds are doing a lot, but the residents of public housing really do have unique needs, so I'd like to see maybe more focus on residents of public housing. I'll tell you one big thing that I feel pretty strongly about is public housing right now, the definition really is your public housing complexes. And I'd like to see that expanded, frankly, to include Section 8.
And what is the relationship that you have with these residents? I mean, how do they feel about the services that you're providing? Is it positive? Could it be better?
It's very positive. We do surveys of our patients at least annually. I say it's at least annually. It used to not be that often, but now it's at least annually. And we get something like 90 to 95% of our patients say they would refer a loved one to us. And that's not like across the board. That's specifically looking at public housing primary care residents. I think their percentage is even higher. So they're so thankful that we put a site over there in the first place, and I think that the thankfulness goes both ways. We're very, very fortunate. We feel privileged to be able to be the primary health care giver to these residents of public housing, and so it works both ways. They appreciate us, and we appreciate them.
All right. And what are your primary barriers to achieving the goals?
Funding, unquestionably funding, and certainly with the budget cut discussions that are going on right now in D.C., right where we're at today, this debt ceiling issue, I'm hoping that there'll be a balanced approach. I think everybody understands that there's got to be some cuts, but we're hoping that cooler heads will prevail, and they'll maybe do some tax increases and not make just draconian cuts, because those draconian cuts that they're talking about will absolutely positively hit the most vulnerable, and that will be residents of public housing.
Thank you. I appreciate it.